Hi, everybody. It is Monday. I hope everybody had a good weekend, a happy Easter. This is the time we come together and remember that we're going to get through this pandemic and we're going to get through it together. And we're going to get through it because we're going to get everybody vaccinated. And we'll talk about that primarily here today. But let's first start with this is National Public Health Week, April 5th through 11th, 2021. 2021 National Public Health Week has a theme. It is Building Bridges to Better Health. 2021 is the 26th year anniversary of National Public Health Week. I want to thank everybody that works in public health. Boy, do we know how critical they are, certainly now, and they have been our rock in getting through this pandemic. They have been there from testing to contact tracing to vaccinating. Those that work in public health are absolutely critical to making our communities and families healthier. So to learn more about this week and how you can show your support, visit nphw.org. All right, today being April 5th also means it's a hugely important day in our year-long plus war against COVID-19. Beginning today, Kentuckians as young as 16 can sign up or can actually go in and get their shot of hope. Right now, everyone in the Commonwealth who is 18 or older can receive any one of the three safe and highly effective coronavirus vaccines made by Pfizer, Moderna, or Johnson & Johnson. In addition, 16 and 17-year-olds are eligible to take the Pfizer vaccine. This means Kentucky is beating by a full month President Biden's goal and his timeline for all eligible Americans 16 and up being able to get the vaccine. We're making this change after weeks of expanded vaccine eligibility. There are now more than 500 vaccine sites across the Commonwealth, and every eligible Kentuckian should be able to make a plan to get this vaccine. We know this is our ticket out of this pandemic, and the faster we get people vaccinated, the safer we are, the more that we can do, and the more likely we fully and finally defeat COVID-19. We know we're going to win this war, but the fight is not over. So this move to vaccinate our young adults and eventually our children as the safety trials proceed and tell us it's okay, these are crucial moments. After weeks of steady decline in cases and deaths from COVID nationwide, many states are seeing a plateau and some a significant increase. Those increases are in younger Americans getting the virus more, younger Americans being hospitalized more. So now more than ever, it is absolutely critical that we get everyone, especially our young people who now qualify, vaccinated. We've already lost more than 6,000 of our fellow Kentuckians to this evil virus. We know there's going to be more heartbreaking loss, but the faster we get everyone vaccinated, the less loss that we will see. This pandemic has taught us how interconnected we are. Each of us, the decisions we make impacting other people. To date, it's been decisions about our behavior, about whether we wear a mask, about what we do now. Much of those decisions comes down to the decision to be vaccinated. Every single person who makes that decision better protects the people around them. And as we look around, we ought to see that it is not only safe, but it's saving lives. Look at our long-term care population where you'll see we have one, I think, new case today. We've had zero for the first time, a couple of times in the last week or week and a half. Deaths are plunging in long-term care. The vaccine is working. So now that decision on how we protect our fellow human being, how we love our neighbor as ourselves is about our decision to take this vaccine, to get signed up and to get it as quickly as possible. Let's not fumble at the goal line. We are so close to fully protecting one another, and I want to defeat this virus once and for all, at which point we will lift each and every restriction that we have had to put in place to protect one another. So let's continue to follow the guidance, mask up, practice good hygiene, and if you're eligible, sign up to get your shot of hope. It will honor every person that we've lost as a flag out back. Now more than 6,000, and heartbreaking as you look from one side to another. It will honor the sacrifices that so many of you all have made, the lives upended, the mental health difficulties that everybody has faced, the loss of savings accounts, of businesses. We didn't make these sacrifices for nothing. We made it to protect one another and defeat COVID-19. So get your vaccine. Looking at vaccines, let's pull up table one. We have now vaccinated 1,438,557 Kentuckians with at least their first shot of hope. That puts us up 43% of our total population 18 and up. I think it's about 41% 16 and up. But now let's look at table two. Still, with 1 day to go, we're already over 100,000 new Kentuckians vaccinated this last week. But we should all be at least a little bit concerned that the numbers aren't that we may have a little slowing in demand. This was before we opened up to everybody 18 and up, 16 and up. My apologies. We believe that now having more than 1.2, 1.3 million more people that are qualified, who are in the groups that are eligible, should make up for some of this lagging demand. But again, folks, we really need you to get the vaccine. And right now, if you're 16 and up, you can probably get it this week. You can certainly get it over the next couple of weeks. Let's pull up some places that we know have a lot of appointments. U of L Health, Cardinal Stadium, over the next week or so is going to have 4,000 appointments. If you are anywhere near that Louisville area, go sign up right now. If you just became eligible today, you may be able to get it in a couple of weeks, and that's something that wasn't possible for others as their groups came up. More than 4,000, meaning if you get online right now, that's Norton Healthcare. I'm sorry, that's not that appointment registration. We'll get that one for you. That is there and available. Second is the Kentucky Horse Park. The Kentucky Horse Park has about 1,800 openings over the next week, meaning if you get online right now, you can get your appointment scheduled. Wedco, if you're in Harrison, Nicholas, or Scott County, 16 and up, they got about 1,200 appointments over this next week. You can get your appointment scheduled. Baptist Health Corbin in Whitley County, 1,100. We can get so many folks in Whitley County and the surrounding counties vaccinated. And in Christian County, the health department at the Bruce Convention Center, about 1,000 appointments open. Our media partners, we hope that you'll push this out further, but it means right now you can get your shot of hope. No more waiting like so many have had to. You can get in here very quickly and get that vaccination. And you need to get the vaccination because what we are seeing, especially amongst young people, again, is an increase in cases and hospitalizations out there, primarily because of the variants. Today, if we look at the B117 variant, which is the United Kingdom variant, 83 identified cases in Kentucky. This is going to be, if it is not already the dominant variant in the United States, it is fueling in some places a pretty significant increase in cases. Here's the thing. We are seeing if you're vaccinated, you're less likely to get COVID from the variant, and it almost eliminates hospitalization from the variant. So the number one reason that you ought to go out right now and get the vaccine is we will see an increase in cases if you don't from the variants. We've got to defeat COVID-19. It's more dangerous with the variant. You need to protect yourself. But here's the number two reason. If you're vaccinated, you can do more things. It is safer to do more things. The CDC is coming out with this guidance. It started out being with fully vaccinated people, you can have small gatherings without masks. How incredible is that? I will tell you that while it feels a little odd after a year and 2 months, it is absolutely incredible and should make everybody want to go out and get vaccinated to be able to be around each other in a normal way again. But Friday, we got the next piece of good news if you're vaccinated. On Friday, the CDC issued new travel guidance, and we're also updating our state travel guidance. Highlights of the April 2nd, 2021 updated CDC travel guidance are as follows. Fully vaccinated travelers are less likely to get and spread COVID-19, and we are no longer dissuading domestic travel if you're vaccinated. If you are vaccinated, Kentucky is no longer asking or advising you to limit domestic travel. Now, you still need to wear your mask. You still need to follow all the protocols, but that's the big news in Kentucky, and we'll be adjusting our website advice. If you are fully vaccinated, domestic travel, while not fully safe, is pretty safe now, and we are no longer prohibiting and or advising against it. If you are fully vaccinated, international travel, you still need to take a number of steps. The CDC recommends delaying international travel first until after you're fully vaccinated. And if you are, you should continue to follow the CDC recommendations for traveling safely and get tested 3 to 5 days after travel. So you still need to follow all that. Okay, so if you're vaccinated, domestic travel, that's something you can do, and we think you can do fairly safely. If you are not vaccinated, it is not safe for you, not even remotely. And so we, again, are advising not to engage in any non-essential travel if you are not vaccinated. If you're not vaccinated, you need to get a viral test 1 to 3 days before your trip. And after you travel, you need to get tested within 3 to 5 days and self-quarantine for a full 7 days after you travel. All of these are going to be updated on kycovid19.ky.gov. But let's break it down again and how incredible these vaccines are and how well they work and what it means to be vaccinated. If you're vaccinated, you get together in small groups of other vaccinated people without masks. If you're vaccinated, domestic travel is now okay, though make sure you're careful when you do it. If you are not vaccinated, those activities are not safe, and we recommend against them. So get vaccinated. All right, looking at demographics of our vaccination efforts to date. Let's start with age. Can we put that one up? Looks like we may be having just a little bit of technical difficulty. There we go. Age. Again, right now, 70 and up, 26.2% of all vaccinations. Remember, that was much higher compared to the others, but there are more Kentuckians, 60 to 69 than there are 70 and up. So we will see these eventually change. Given the way that we've opened our priority groups, this looks the way it should. But we are going to start seeing, now it's open for everyone, these beginning to change. I do think it means we have done this right. I do believe that we've made the right decisions at the right time. And as we move forward, this graph is going to be less important as compared to the overall amount of Kentuckians that are vaccinated. We continue to see the overall percentage of Kentuckians 70 and up that are vaccinated continue to climb. I believe it's now over 70%. And we watch the others as they continue to increase as well. Look at gender, 57% female, 43% male. I think we're certainly seeing some more hesitancy among men. Get vaccinated. It protects people around you. Get vaccinated. When we look at ethnicity, 1.8% Hispanic, 98.2% non-Hispanic. And then finally, as we look at race, continuing to see gradual improvement. It's now 85.44% white, 5.08% Black or African American. I think this is the first report where we have fully been over 5%, 7.94% other, 1.34% Asian, and then everything else is under 1%. Again, we'd like to see it improve faster, but there's a lot of intentionality in how we're going about the equitable rollout. There is a huge amount of community leadership that is having an incredibly positive impact, that is moving those numbers in the right direction, and we are committed to getting them fully in line with the population. Again, a lot of great work done, especially at the local level, that continues to see improvement there. Let's go to Sunday's COVID report first, and then we'll talk about the last week, and then we'll do Mondays. On Sunday, Easter Sunday, we saw 299 new cases of COVID-19. We saw 5 new deaths and 9 additional deaths from our audit for a total of 14. We had a positivity rate of 2.89%. The deaths coming up from the local health department, the 5, included an 87-year-old woman from Boyd County. That was a February death. A 72-year-old man from Boyd County, a December death. An 82-year-old woman from Logan County, an October death. A 90-year-old woman from Mason County, a March death. And a 68-year-old woman from Warren County, a November death. And as we go through these, every loss is real and everyone needs to be acknowledged. We may be seeing fewer in March, which we hope is a very hopeful sign that coincides with the vaccination numbers. The deaths from the audit for Sunday include an 85-year-old man from Bullock County, December, a 74-year-old woman from Clay County, December, a 91-year-old woman from Fayette County, December, a 58-year-old woman from Hardin County, December, a 74-year-old man from Harrison County, December, a 76-year-old woman from Jefferson, October, an 83-year-old woman from Jefferson, December, 88-year-old woman from Jefferson, January, and a 79-year-old woman from Simpson County, January. It tells us that this part where we peaked, just like the rest of the country, was one of the deadliest periods I think we've ever had in our history, with unfathomable losses. But again, if we can get everybody vaccinated, if we can continue our momentum on the vaccination front, we won't have to face again, and I hope we'll never face again in our lifetimes. All right, so if we look at the trends, let's pull up our stair-stepper chart. This last week ended our 12-week decline in cases. We had 4,377 new cases in this last week. The week before, 4,196. It means Kentucky, at least as of this week, is no longer on the decline. But let's look at our test positivity. And our test positivity is a leading indicator, which means we should see changes in it. And you see the decline we had there as well in test positivity. We should see that before we see the decline or the increase in case numbers. And what you'll see is really for the past 3 weeks, we've been pretty much at the same general positivity rate. So what we at least believe at this point is that we have hit a plateau, that we are not currently in an escalation. So is that good or bad news? First, it's not good news if we are no longer declining. We always want to be declining. And remember, our numbers are still fairly high as compared to early in the pandemic. It's good news, though, that we are not escalating. But remember, other states that were declining plateaued for a period and then increased. So we need to be vigilant. We need to be a little bit concerned. And in being concerned and in seeing this, we need to say that, yes, a fourth wave is absolutely possible, because every other time we'd have an increase and then we'd have a plateau for a period and then we'd have an increase. Here we've had a decrease, but now a plateau. Every time we've plateaued, what have we seen afterwards? We've seen an escalation and an increase. We can avoid that. We can avoid that if we do 2 things. Number 1, continue to wear a mask, engage in social distance, know that we're in the 4th quarter. We got to keep playing. Know that we can't fumble the ball this late. Number 2, get vaccinated. If we, even with the variations and mutations that we see, if we get everybody vaccinated, by and large, no one goes to the hospital and nobody dies. That changes this thing entirely. Think about that. Nobody goes to the hospital, nobody dies. That ought to be enough to get all of us signing up for our appointments. If we look at the inpatient census, we're plateaued pretty much in hospitalizations. I mean, I think we're up or down 1 or 2 the last couple days. Same thing in the ICU, which as you'll see, has a little more variation, but you see the plateauing there and the ventilator. Again, those numbers bounce up and down, but the last several weeks, certainly there is if you average them, that same plateau. Looking at hospital capacity, again, this is a positive sign that we really only have one region where we have any concern in our hospital capacity. That's with our ICU beds, but we're not concerned overall as a state. Now, today's COVID report, we believe, is impacted by the holiday weekend, by a number of labs being closed. So it's going to be hard to tell what's going on this week, probably until about Wednesday. And so Thursday, we'll talk about where we kind of are on what we believe the trajectory of this week is. So today we have 110 new cases of COVID-19. That's lower than any of the last 3 weeks. But again, the last 3 weeks didn't have lab closings like this last weekend did. So let's just wait and see. We have 4 new deaths coming up from our local health departments, and we have 4 audit deaths today for a total of 8. Hospitalization, ICU, ventilator, all relatively stable, up or down 1 or 2. Our positivity rate is 2.9%. Remember, on Saturday, we were back over 3. Now we're back down to about we are down to 2.9%. We look at the new deaths coming from local health departments. Only one is in March. They include a 70-year-old man from Carter County. It's a February death. A 79-year-old man from Fleming. That's a November death. He died on my birthday. An 80-year-old man from Floyd County. That's a March death. And a 78-year-old man from Todd County. That's a January death. The audited deaths are all from November. They include a 92-year-old woman from Boyle, a 90-year-old woman from Callaway, an 89-year-old woman from Henderson, and an 82-year-old woman from Laurel County. All right, let's talk about good news. Again, driven by vaccinations. Let's put up long-term care facilities. 1 new resident testing positive, just 1. 3 new staff members testing positive. Think about this. We've almost never had, until recently, more staff testing positive than residents. And I think if you tune in every week, you know why. Is that the vast majority of residents got the vaccine, and a little less than half of the workers initially got the vaccine. We believe that's improving, and we're working on that. But we now have fewer residents who are far more at risk than staff getting the virus, and 0 new deaths. 0. It's great every time we get to report it. All right, one final update. Like many other states across the country, Kentucky has seen a surge in fraudulent unemployment insurance claims. Last week, the U.S. Department of Labor launched a new website to help all victims of unemployment identity theft. The agency unveiled a new webpage, which can be found at dol.gov, to educate the public about the growing problem of unemployment identity theft and provide reporting guidance for citizens in every state. In an effort to address the high volume of fraud claims here, our Office of Unemployment Insurance has added a new welcome screen to the claimant website with a more secure login. Our teams also updated the fraud form to report identity theft on the site, enter into a new partnership to adopt new security measures, and the office has put a hold on certain claims until identification can be verified. Most recently, OUI announced Friday it was stopping all claimants from making changes to bank account information on file with the agency. The move comes after OUI was made aware that claimants were reporting unauthorized changes to their bank accounts in recent days. In its newest form, the fraudulent activity occurs when criminals exploit unsophisticated PIN numbers created by claimants used in conjunction with publicly available information obtained from other sources on the internet. The agency now requires new and existing claimants to create more complex PIN numbers. In addition, all new UI claimants will only be paid by paper check, effective immediately. To continue fighting this fraud today and realizing that it knows no state bounds, nor is it only impacting state agencies. It's stealing from federal agencies as well. So today I signed an executive order creating the Kentucky Unemployment Insurance Fraud Detection and Prevention Task Force. I did this because immediate steps are necessary to identify vulnerabilities and develop solutions to counter, prosecute, and recover funds related to fraudulent unemployment claims that have been filed in the Commonwealth of Kentucky. Fraud, as it relates to unemployment insurance claims, is rampant. The number of fraudulent claims filed across the United States is staggering, with more than $63 billion having been paid in fraudulent benefits. We're seeing this activity all throughout the country, and unfortunately, Kentucky is no exception. Much of the fraud in the system is being perpetrated by very sophisticated organized crime rings, not some fly-by-night scam operation, and it's going to require multi-agency, multi-jurisdictional response to root it out. So the task force includes a wide variety of organizations, including Commissioner of the Kentucky State Police, Executive Director of the Kentucky Department of Homeland Security, Secretary of the Transportation Cabinet, State's Chief Information Officer, the Executive Director of the Kentucky Office of Unemployment Insurance. We are also asking representatives of other investigative agencies, both state and federal. Think about the FBI, think about the U.S. attorneys, think about the Office of the Attorney General. We are asking them to join on this task force to partner with us. We'll continue to take these steps to do everything we can to prevent fraud. All right, with that, we will open it up to questions. I know we move quickly. I think we've got both Dr. Stack and Amy Cubbage available if they have the knowledge base to answer the question. Have a number of reporters on the line, have some written questions. We will try to go back and forth between them. We will start with Chad Hedrick from WKYT.
Hi there, Governor. I wanted to ask a little bit more about the demographics with vaccines, specifically with the Hispanic population. Do you have the data in terms of the percentage of that particular community that's gotten the vaccine? And also, what is their makeup of Kentucky's overall population and efforts to get them vaccinated as well?
Dave, will you give me the population numbers? On vaccinations, 1.8% of vaccinations people vaccinated have identified their ethnicity as Hispanic. We'll pull up the population numbers, and I'll add those here in a minute. We are doing intentional outreach to this community. It's taken on a number of forms. I participated in many of them. There also have been pop-up clinics aimed at vaccinating individuals in this community, including a full day put on at Louisville's Broadbent Arena site and many others. Debbie Yetter from the Courier-Journal.
Hi, Governor. I wondered if you and your staff have been reviewing bills passed in the last 2 days of the legislative session and have identified any you might be thinking about vetoing.
Haven't identified ones that I might be vetoing yet, but I did sign a number of bills today. If you have a pen, I'll read through their numbers. House Bill 178, it's related to the Board of Education. House Bill 389, related to dependency, neglect, and abuse. House Bill 492, related to child welfare. HCR 81, which is support of future vertical lift at Fort Campbell. House Bill 497, this is about providing information and assistance as prisoners are released from correctional institutions to try to give them the best shot moving forward. Senate bill, and by the way, it also eliminates the previous restriction on SNAP benefits for felons. Again, that's making sure that people don't go hungry. I wish we hadn't done that to certain children during this session. Senate Bill 99 I signed. That's about Bluegrass Station. Senate Bill 146, background checks for certain UI employees. Senate Bill 162, which is a reorg for the Secretary of State, Office of Claims and Economic Development Cabinet. Senate Bill 215, House Bill 163, House Bill 125, and House Bill 261. Those were all signed into law today. I believe that we're going to have more information this week, most likely on Wednesday and then on Friday. There's certainly some bills that I think have done some really good things, and that, like before, we may put together to talk about the good work that have been done about those. Right now, we're looking Wednesday and Friday. And certainly near the end of the session, some good bipartisan work, especially with the American Rescue Act, but then also some investments with some of our communities that have been ignored for too long. So I think we're going to get to talk about some positive bipartisan work. Dave, do you have just the percentage? Okay. What I've got right now is that the Hispanic population is 3.44%. That's something that we will want to double check that we just looked up, Chad. So that's not from, I don't think we can't make that official today, but that looks like what we located. Next is Stu Johnson from WEKU.
Thank you, Governor. Good afternoon. I guess kind of on two ends of the equation here, you've mentioned about the plateauing of cases and the possibility of an increase. Some of the national discussion has talked about a fourth surge. I mean, could you see a fourth would be characterized as a surge in Kentucky? And I guess on the other side, in terms of vaccinations, are you concerned there could be a stalling of vaccinations?
Two good questions, and I think it's too early to tell. It is not written in stone that we are going to have a fourth surge. Things we do right now can prevent that fourth surge, and we have had declining cases longer than just about any other state in the country, meaning we are better positioned if there's going to be one, having delayed it, while we vaccinate more people. Our vaccination speed is better than virtually all of our neighbors, and we think compares well in the rest of the country. But those two questions are connected. Whether or not we have a fourth surge depends on continuing to follow guidance and wearing a mask in public, doing all the right things. And number two, how quickly we can vaccinate everybody. Too early to see if we have a stalling in vaccinations. I think a lot of people traveled this last week. Again, I wish they hadn't, but a lot of people traveled. Also, we just opened up to a lot more people. So, Stu, I think looking this next week and the week after, really in 14 days, we're going to be able to tell whether we've hit a real stall or opening up to more people was the right thing to do, or other things that people were doing, they were pushing off getting their vaccine. So too early to tell. Am I concerned about both? Absolutely. Absolutely. That's why we've got to get everybody vaccinated. Trevor Peters at Fox 19 Now. The New York Times listed the Brent Spence Bridge as one of several projects that could be included in President Biden's $2 trillion infrastructure plan. Is there any indication that the Brent Spence Bridge is one of the 10 most economically significant bridges the plan targets? So I asked that very question because I am pushing to get the Brent Spence Bridge included in that infrastructure plan. And I was told that the 10 have not been selected, but certainly it would be hard to argue the Brent Spence Bridge isn't one of the top economically significant bridges in the country. That's about as specific as they would get with me. I certainly believe it is. I'm pushing to get it included. It would be a huge benefit for Kentucky and Ohio. It would create a lot of jobs, but more importantly, it would protect one of the most economically significant arteries in our interstate system. Tom Latek from Kentucky Today.
Good afternoon, Governor. And I've got two and maybe three here, if I can make them quick for you. Some states have talked about having a vaccination card or a database where that information is available for people who are totally vaccinated. Is Kentucky giving any thought to doing that? And one of the bills you didn't mention was the election bill. Where does that stand?
So reviewing the election bill right now, it's got a lot of different pieces in it, but we expect to have a decision out here soon this week. Certainly excited about the possibility of having 3 extra days to vote. Also would note that there appears to have been bipartisan work on it. Those are all good things. We're just making sure we do our diligence. On the other one, you talk about a database. Some people talk about a vaccine passport. A lot of people are talking about that in terms of government. I got to tell you, I expect the private sector to go there. When you look at wanting to encourage people to come to different tourist locations, when you talk about bringing people in to different facilities, I believe that the private sector and looking towards safety is going to drive ways to prove that you've been vaccinated to have certain opportunities. And while everybody's focused on government, I think the private sector and the way that it innovates is going to want to know who's fully protected and who's not. Melissa Patrick from Kentucky Health News.
Hi, Governor. So with the report of 15 million Johnson & Johnson vaccine doses being ruined in that lab mix-up, has there been, will that affect our prison system? Has there been a holdup on vaccinating our state's inmates because of that foul-up?
No. So the foul up, and I hate that it happened, was not a part of any of the projections that the federal government had given to us on Johnson & Johnson, at least for the coming weeks. So that has not interrupted our plan to get our inmates vaccinated. We also get our Johnson & Johnson at the moment from a different facility. So that foul up shouldn't hurt anybody's confidence in the Johnson & Johnson vaccine. But no, our plan and our timing is continuing as announced. We've got one for Dr. Stack. The variant first detected in India, now in California, being referred to as the double mutant variant. What could that mean for the spread of the virus? Steve?
Thank you, Governor. So this is an interesting story, but it's probably more interesting for the bigger points that it can teach us. So the virus mutates continuously. The more people who get infected, the more opportunity the virus has to mutate. Certain mutations are more common than others. And sometimes these mutations happen at the same time in the same virus. So this, quote, double mutation that is referenced in the question has to do with 2 different mutations that apparently were identified in India in the same virus that was sequenced. And it raised the concern, with those 2 mutations taken together in the same strain of the virus, give that particular version of the virus the ability to circumvent the protections the vaccines provide, or make it more dangerous to people who get infected, more lethal, or would it make it potentially transmit more easily? Those are all questions that still are to be determined. It's still being looked into. The bigger point, though, is the vaccines are working, and wherever they have been used, they have shown a substantial positive benefit in keeping people from dying and keeping people from getting sick enough to go into an ICU and require mechanical ventilation. They really work tremendously well to prevent mortality and severe disease. So we need everyone, for your own safety, your own protection, to get vaccinated as soon as you have the opportunity. And as the governor has said, there are plenty of opportunities across the state of Kentucky now where you can sign up and get vaccinated this week or within the next couple of weeks, almost certainly. So we really need folks to do that. Additionally, as you see the CDC changing its guidance and Kentucky mirroring that, now you can travel throughout the United States if you're fully vaccinated and do so with a higher degree of confidence that you will remain safe and your loved ones will remain safe. So for these variants and for this, quote, double mutant variant, the most important thing is that we all need to get vaccinated as soon as we can so that fewer variants have the opportunity to form. Because if we allow it to continue to spread rampantly, it's just a matter of time before different combinations occur that have more negative impacts. So for right now, that's more of a news article of curiosity than proven yet, although it could be, but then proven yet to be a danger to folks. But we've got to stay vigilant, wear your mask, keep your distance, wash your hands, and please get vaccinated when it's your turn. That's how we get ourselves out of this mess. Governor, back to you.
Next up is Ryan Van Velzer from WFPL. Ryan?
Thank you, Governor. Now that all Kentuckians ages 16 and up are eligible to receive the vaccination, what's the state's position on waiving residency requirements for vaccinations, allowing undocumented immigrants and those from nearby states a chance to be vaccinated in Kentucky?
That's interesting on the undocumented piece, and let us check on that. I mean, everybody needs to get vaccinated. We think we're close to lifting residency, say from those in Ohio, coming over in Northern Kentucky or elsewhere. But just like how we've gradually opened different things, we think we need at least a couple more weeks. We think we're going to have an announcement, especially as it relates to Northern Kentucky in the future, where we're going to be able to open it up more. I think we are really close, but we are not quite there yet. Certainly, if we continue to see open appointments, that's something that we will very strongly consider, because the people of Northern Kentucky aren't safe until the people of Cincinnati have been vaccinated, and the people of Southern Kentucky aren't safe until the people of Tennessee have been vaccinated. So it's a good point, and again, we believe that we are pretty close to making that happen, but we need at least a couple more weeks. Here's one. I think this is a quote from. I'm being asked about a quote from Senator McConnell, who says he didn't think the state needed the last infusion of federal aid, saying the state was okay financially before what we did last year. The governor kept predicting things that did not occur. So what we did last year was a big bonus for Kentucky on top of what it needed. This is an even bigger bonus. Oh, I guess that's referring to the last CARES and then the American Rescue Act. I'm sure they'll love to have it, but I don't see that they needed it. I disagree. It's a question of, do you want a long, difficult recession that hurts Kentuckians, that has more people jobless, or do you want to invest, create jobs, and sprint out of this pandemic instead of stumble? What the American Rescue Act is going to allow us to do is create tens of thousands of jobs, to upgrade our infrastructure, which we should have done during the Great Recession, and to really move this state forward. I don't know about y'all, but I don't want to be in a recession for the next 3, 4, 5, 6 years. And what we have right here in front of us is a chance to stimulate Kentucky's economy. And listen, the reason that we didn't have big deficits in state government is my administration managed it well. We made the early cuts when we had to. We used CARES Act money where we needed to continue to provide services. And I am not going to apologize for being fiscally sound and, when need be, fiscally conservative. But to use that against us on whether or not we needed the money, that ain't right. So this is a benefit for every American out there. Again, do we want a long, drawn-out recession, or do we want to get our economy booming again? The difference between before that last CARES Act and before the American Rescue Act and what we're hearing from businesses now is night and day. And I'm truly excited about the economy in front of us. But that took these actions that have happened, and they were right to do them. Both the CARES Act under one administration and the American Rescue Plan Act under the new administration. All right, Catherine Collins with WLEX.
Hi, Governor. I am wondering, I was going to ask that question that you just answered, but I will ask about demographics on vaccines instead. Can you talk more about the disparity between men and women in vaccinations? And also, I do believe Senator McConnell also talked today about encouraging Republican men to be vaccinated. Is there anything else that your administration is doing to encourage vaccines amongst that group?
Since I just disagreed with him respectfully, let me also say something real positive about Senator McConnell. He has followed the COVID restrictions. He even followed them during his campaign, and that's setting an example then, and it's also setting an example on the vaccination side. We need him and other Republican leaders, both state and nationally, to truly encourage this. I sent a letter to our entire federal delegation because we need each one of our representatives and senators strongly coming out for especially Republicans and Republican men to get vaccinated. It's just the data we see says that overall men are more hesitant than women, and Republican men are more hesitant than virtually anybody else. To me, I want everybody to get the protection that a vaccine provides. It protects a Republican man as much as it protects anybody else. So whatever education we need to provide, whatever we need to dispel, whoever needs to say it, whatever needs to get them to that place, I want to help. Now, there are some that may not listen to anybody, or there may be some that only listen to one person out there, and we really need them to open their minds and open their hearts. You know, to me, being vaccinated was following the science, but it was also following my faith and knowing that it could protect those around me. So I hope other people will think about it in terms of values, of faith, of defeating this pandemic, of being able to travel again, of being able to get together with small groups without your mask on. We just need everybody to get vaccinated. And last but not least, David Winter, WKRC Local 12.
Thank you, Governor, for taking the question. Two questions, really. The first one is the state, back when the pandemic began, had waived the requirement to seek work in order to get unemployment insurance benefits. When are we going to get rid of that waiver? And aren't we incentivizing people not to seek work now that jobs are available?
So we were just talking about that the other day, and we fully intend to reinstate the job search requirement, and we're looking at doing that previously until the federal government took some different steps. And the job search requirement is you at least have to search. There are people hiring out there. We want to get people back to work, especially since we believe it's getting safer and safer. Obviously, the level of safety depends on how many people get vaccinated and how well we follow the rules. But the point is valid, that we're getting back to a point where those that are on unemployment, that could be for many reasons, at least need to be looking for work, and we need to be connecting them with those that can provide those employment opportunities. We will get an update on that on Thursday when we typically talk about UI, but this was a conversation that I've had several times and am for reinstating it, just wanting to find that right time that may be now where, again, you can go back to work and go back safely. Certainly with the level of individuals we've vaccinated, if we're not there, we are getting there. I want to thank everybody. Obviously, a lot of interesting news today. Being able to travel domestically if you're vaccinated, again, having to wear the mask and do all that, but still, just another thing you can do. And this is going to continue. Those that are vaccinated, again, you're less likely to get sick. It looks like you're less likely to get the virus. You may well be less likely to spread the virus. That means you can do more things and you can do them safely. So get vaccinated. All right, for a COVID update, we'll be back on Thursday of this week. We will likely have a couple of updates this week on legislation being signed or vetoed as well. Everybody be safe, take care, follow the rules, and get vaccinated. Thank y'all.